A Teesside disability rights campaigner says she's concerned that doctors are placing do not resuscitate or DNR orders on disabled people without their knowledge. Baroness Tanni Grey-Thompson says in recent months she's helped some disabled people overturn orders that could have denied them life-saving treatment. The former Paralympian says not enough value has been placed on disabled lives during the pandemic. Well, our political editor, Richard Moss, has been talking to her and others concerned about this. So, Richard, what did Tanni Grey-Thompson have to say?
Well, there's been concern from the start of the pandemic amongst disabled people about the use of DNR, do not resuscitate orders. Now, these effectively prevent any further treatment if the heart stops, so you don't try and intervene and restart it as you would with someone who doesn't have a DNR order. An estimate suggests around 2/3 of the people who died in the pandemic have had some form of disability, and that's led to concerns amongst disabled people that perhaps whole groups of people are being written off, effectively, something that certainly doctors would deny. But Tanni Grey-Thompson says she's also come across evidence that on occasion there are disabled people who've had DNRs put on their records without their knowledge and without consultation.
Over the last few months, I've dealt with a number of cases where DNRs have been placed on patients' records without that conversation. And that conversation, we need to have a conversation about death. We need to be talking about these things. And in difficult times, it's not easy to do that. But it's very shocking when disabled people find that on their records without knowing anything about it.
And you've been talking to some disabled people and their carers about
Yes, I was talking to Judith Brown from Middlesbrough, who cares for her daughter Monica, who has a learning disability. We did some filming with her a couple of years ago. Now, the figures suggest people with a learning disability have been 6 times more likely to die of COVID in the pandemic. Now, Judith's been very concerned about the possible use of DNRs on her daughter, but also about guidance to doctors issued at the start of the pandemic, which seemed to suggest that disabled people would be treated in a different way to someone who wasn't disabled, and possibly in an inferior way in her view. Now, those guidelines were adapted, but she says her trust in the NHS has been knocked.
It was like a betrayal by a trusted friend, in this case the NHS. You think there's a discrimination unworthy of this group of people who are in robust health in many cases. You know, they live healthy, strong lives, well maintained with medications, and to dismiss that so easily is a discrimination, and it's a wrong too far.
Now, I've also been talking to Clint Durham, who's a disabled rights activist in Teesside. Now, he recognises that sometimes the nature of someone's disability may mean that a DNR might be appropriate. It may not be a good idea to try and restart their heart. But he says individual circumstances and all those areas need to be looked at as a whole.
If they're related to COVID treatment, that's fine. But if they're not related to COVID, then they should not be taken into consideration. We understand that NHS staff have to take difficult decisions, but it needs to be on the clinical reason and not based upon their own personal presumptions about our lives.
What's been the NHS response?
Well, the NHS sent me a statement which said it's repeatedly instructed local clinicians that the blanket application of DNR orders to groups of disabled people will be totally unacceptable. People need to be treated as individuals, and any decisions about DNR should be made in consultation with patient, family and carers. Now, I should say DNRs only apply to this intervention to restart the heart. It doesn't mean that you won't get any treatment possible to save your life before that particular moment. But Tanni Grey-Thompson believes there is now a need for talks between the medical profession and disabled groups.
It is discussions with the medical profession to help them understand about the lives of disabled people, and to move on from thinking that they have nothing or we have nothing to contribute. On a one-to-one basis, it's having a discussion with an individual about why a do not resuscitate has been placed on them. There shouldn't be a blanket do not resuscitate purely because of somebody's level of impairment. It's got to be at a more one-to-one level than that.
Of course, the good news for many disabled people, including Monica, we saw earlier, is that they are starting to get vaccinations. Many have been vaccinated amongst the vulnerable groups. Monica's had her first jab. But of course, the outbreak isn't over, and concerns about the value placed on disabled lives predated COVID. And I'm sure that all the people involved in the filming tonight would say that they'll probably still be there beyond the pandemic.
OK, Richard, thank you very much for that. Thank you.